Yes, I'm Dr. Samir, and welcome to the Indian Academy of MRCS. And today we have so many of successful surgeons here along with us who just passed the MRCS A exam in the April diet. And I know that all of you who are aspirants for September session or next year January session, you have so many questions regarding your preparation, and you want to know how did they start their preparation, whether they were doing residency or working, and what material they used, uh, how whether they subscribe to EMRCS or not, and why did they choose IM? Was it enough? Was it worth? And what was the difference between IM and subscription of EMRCS and past test, and like what other books they used, and how much daily time they were putting in, the method of their study, the overall experience of their exam. So many questions I know that you have in your mind. So I won't take much of your time, and I will invite Dr. Dineshwaran from Malaysia to start with, and let's see what he has to tell you. How are you, Dr. Dinesh?
Hi, I'm good, Samir. Am I audible?
Yes, 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 you're audible.
Okay. Hi all. I'm Dinesh from Malaysia. I hope I'm audible to all of you all. Nice to have all of you as part of us. So about IAM, without further ado, I just will talk about few things how I get to know about IAM is through my colleague who passed recently in January, I guess. Then he was the one who introduced IAM to me. So before that. I was contemplating whether to take this exam or not. For almost 1 year, I delayed to take this MRCS itself because many of my colleagues didn't really make it. So eventually, it instilled a fear in me whether I can do it or not. I have so many doubts in myself. So I had all the doubt, like all of you right now. You might be having all the doubt. What am I going to do with this course? Is it worth it? Am I going to waste my money? And let me tell you, I didn't even regret a single cent of mine by joining this IM group. The course were well structured. The lectures are very concise, and the bomb was a masterclass. It was awesome. It trains how your brain to be react and reflex, and how I answered the MRCS online. That's like you can literally hear all the lectures, what the bone marrow, what the Samis were telling you. It's like, hey, this is the answer, choose this, that kind of things. You had confidence towards the end of rapid course of revision. You just become very confident. You know you can do it. I mean, I had that confidence, not overconfident, of course, but you know you can do it. That kind of things. That's my part of experience based on that.
Okay, thank you, Dr. Dinesh. And if any of you have any questions, like what material did you use, Dr. Dinesh? So many of this members they have asked, like,
Actually,
yes, yes, yes,
okay,
please go on.
I have signed up for EMRCS, but didn't really use it. Purely what I use is the entire thing is from IM. Everything is from IM. All the lectures, all the notes was from IM. I mean, I didn't even buy anything extra. Even the EMRCS, I stopped doing it at one time. It's like, okay, no use. It's like the lectures and things are much better. It teaches you. Obviously, during the lectures, you'll be grilled for making mistakes, but that's what you remember for your lifetime. This is the answer for that. No, it's good session. I think it changed a lot with the one-to-one session discussion. We had a lot of understanding on that, what is going on, rather than you just reading and memorizing. I don't think really gonna be working for maybe for some of you, but for me, no. I think it was a good experience overall.
Okay, and how was your experience on the exam day?
I was very stressed because first of all, I don't know whether my my laptop gonna crash. It was old laptop, but eventually it turned out to be good with all the motivation from Dr. Bonmero, the summit, continuously motivating us the day before. Do not discuss, do this, do that. Okay, these kind of things mentally prepared us, and more or less, I mean, most of the quiz session were like 3 hours session for us. I mean, before the exam. So it eventually train you to sit still and train your brain, don't get tired. So that was good. I mean, questions wise, I mean, more or less like what I said, you can most of the questions are from our discussion. So you never had a doubt to click the answer. This should be the answer. You know, you never think twice. That kind of thing.
Okay, okay, great, great. Thank you, Dr. Dinesh. And again, congratulations for passing
Thank
the
you.
Part A exam, and I hope that you'll pass the OSCE exam as well. Thank
Okay,
you.
thank you, sir.
And we'll have next Dr. Sumbul Bhatti. Bhatti, are you here with us?
Hello, yes, I am.
Yes. How are you?
Can you hear me?
Yes, yes, I can.
I'm very well, thank you. How are you?
I'm fine. Thank you.
Hello?
Yes.
Okay.
Please tell us, like, how was your overall experience, and whether you're working, and how did you start, what books you used, everything.
So a little bit about me. I'm in my first year of a junior doctor. I'm a current foundation year 1 doctor working in the UK. And I know that I really want to do surgery, so I decided to attempt the Part A exam. I had no idea whether I'd be able to pass it or anything. And thanks to the IAM team, I feel like I wouldn't have passed without you guys. And I passed in my first sitting with over 80%. And that was all because of IAM. I did it all whilst working full time. And, you know, with your lectures, your rapid revision course, the daily quiz sessions, and the masterclass at the end, I think that was just incredible. I remember on the day of the exam, I'd done the first exam paper, and I think I like got up and like was so happy because all of the questions, literally every single question in the first paper was all from the masterclass. And it just made me really confident for the next 2 papers as well. So yeah, really, really good experience. And what I really liked about the IAM team is, although I was working full time, and because of the UK times and the Indian times being different, there was sometimes I would miss a lecture session or miss a teaching session, but there was always time for, Dr. Bonemarrow would always try to make sure I attended the session after a session that was already hosted. And also you get the Zoom links to the videos so you can watch them at your own time as well. So I thought the whole course is really well organized. Definitely worth your money, guys. Please invest if you want to pass first time. And yeah, please don't buy any books, just use EMRCS, and that's all I did with the IAM course. Yeah.
Okay, great, great. It's so good to hear your experience, and I'm really so happy for you. And
Thank
all
you.
the best for the OSCE exam. Hopefully, we'll study together again for OSCE as well.
Yep, absolutely. Thank you.
Thank you,
Best of
Dr.
luck, guys.
Thank you. And next we have Dr. Jayant. Dr. Jayant.
Yes, good evening, Dr. Samesh.
Yes, good evening. How are you?
I'm good. How are you?
I'm fine. So please tell us about your situation and how you cracked it and how you started, past experience, everything, please.
Yes. This was my second attempt. I failed my first attempt because of lack of proper guidance. So even though I am a post-MS candidate, I thought I could clear the Part A, just by studying daily, but that didn't work out. Then I actually one of my colleagues recommended me to join IAM since the last time, January session, he had passed and he had subscribed for IAM. Then I joined IAM. Then, IAM is just awesome. The course, the schedule they have created, the rapid revision course, especially, that's like awesome. They are created in such a way that you revise the subject twice or thrice, and thanks to their daily quiz sessions, in which day by day I gained my confidence over the time. And by the end of the quiz sessions, I was able to answer almost all the questions. And secondly, regarding the master classes, they are just amazing. Almost 90% of the questions were from the master classes only. And regarding the books, I just studied Bailey, and I did EMRCS twice or thrice, and just I just blindly followed IAM, and thanks to IAM for the success. And that's it. Thank you.
Thank you, Dr. Zen. I have one question for you. What was the difference that you found in your first attempt and this time?
Even though I knew the subject overall, but I was not, prepared for the exam.
Okay.
Even though I knew the subject in a vast variety, I mean, the knowledge is, I mean, this general certificate is a broad, I mean, the EMRCS part is a broad specialty. I was not concise actually. So what IAM did is they guided me to study only specific topics so that I could easily crack the exam. So that is the best thing which that I gained from the IAM. They guide you so that, you can easily answer. That was the best part of the IAM.
Okay. And how many hours you're giving in daily?
Oh, yeah. Actually, I was working when I was giving my party. Last month, since last 4 weeks, I used to give almost 6 hours per day. And the last week I took off completely. And the last week I almost studied to 10 to 12 hours per day. Just revised IAM notes, IAM master classes. That's it.
Okay. Okay. Thank you, Dr. Jayant, and all the best for part B. And it was so good to have you here.
Thank you, Dr. Sami, Dr. Gomaro, and team IAM. And thank you for all my batchmates who were a part of IAM. Because of all the discussions, I was able to do it. Thank you. Thanks, everyone.
Okay. Thank you, Dr. Jayant. Next, we have Dr. Vatsal. Dr. Vatsal, can I please have you here?
Hello.
Yes, Dr. Vatsal.
Hello, Mr. Samir. How are you?
I'm fine. How are you?
Thank you so much for all the support. IAM team is just fantastic. I don't have any words to thank them. That I cleared it in the first attempt, and really, I mean, I am post MS 2 years after that, so I never thought I would do it in the first attempt. But all the thanks to the team MRCS and the group study team, which was through this MRCS.
Okay, great. Can you tell us about your work schedule and study schedule? How did you manage it?
Yeah, so I am working in UK right now as an orthopedic junior clinical fellow. So I started my preparation in January, and I could give along with my working hours and family, I could give only 1 to 2 hours daily. And I initially joined EMRCS before I knew about IAM. So I was solving 1 to 2 hours daily EMRCS, but then I just stumbled upon in Telegram in the IAM group. I joined the IAM group, and these daily question sessions were they were really amazing because they were just 1 to 2 hours per day, and they would just grill you around 50 to 100 focused questions. I mean, I always believe that there are the repeat questions in every exam which guide you easily through any exam. So this IAM, what they believe in multiple hits. So that something which really helps, because multiple times you go through the same question, even when you are doing some mistakes initially, the number of times you solve with them, it just gets in your subconscious reflexes. You just end up doing it correctly. So I remember I joined the rapid revision group, but till then I remember that most of the EMRCS question were already revised. Most of the past test questions were already revised, and during the rapid revision, each lecture, each discussion it was just fantastic, because after each discussion, whenever I used to solve EMRCS, the mistakes would automatically reduce. I did EMRCS thrice, and I did all the questions which rapid revision this IM group told me. I did not had any other schedule. I was doing my emergencies, I was doing my on call. There were days I was not oriented what I need to study, what I should study. I just blindly followed what the group told me, and what the discussion we and other colleagues had in that group. So, and only it was the last 10 days which I kept study leave completely, because I knew that I wouldn't be able to manage during my on calls. So I took a complete study leave in the last 10 days. And their grand tests were amazing. I mean, they would just give you mock tests. Each paper was just filled up with highly, highly potential revision courses. I mean, revision questions. And in the last 15 days, it was just master classes, Pavia sheet, past papers, everything was there. Everything was there. And during the exam, I could just listen. I could just, whenever I saw a question, there were times when the voice of Mr. Bone Marrow and Dr. Samir would just echo in your brain. This is the question and this is the answer. You wouldn't even spare us extra second on the question. You would just see the keywords and you will just ensure you, yeah, this is the question they have told you about and this is the answer. You don't have to see for other options as well. And everything went so smoothly. I couldn't believe that I cleared it in the first attempt. Thank you so much, Dr. Samir, Dr. Bhargav, Dr. Bone Marrow, everyone. Thank you so much for all the support.
Thank you, Dr. Vatsal. Thank you for the kind words. And I'm so happy. All of us are so happy that you cleared the exam, and hopefully we'll clear the OSCE also together.
Thank you so much, Dr. Samir.
Okay. So thank you, Dr. Vatsal. And next we have Dr. Vartika. Dr. Vartika, are you here?
Yeah, hello, sir.
Hello, how are you?
I am fine. How are you, sir?
I'm also fine. Yes, Dr. Vartika, please tell us about your experience. How did you start and what were you doing? How were you working and everything?
Yeah, for me, this result is nothing less than miracle, because I've tortured you people a lot because of COVID cases in my home, and I'm absolutely indebted to you people. Because if you have not forced me now, I would have given up this attempt. So really, really thankful. This is the first thing which I want to say. The next is like, this was my repeat attempt, and being an ENT and reading surgery and ortho is like a tremendous job to do. And I was already, I'm doing senior residency in ENT and I'm in third year in SR. So with work and all, everything was a bit difficult. But somehow I just got to know about IAMRCS in January and December. And then I decided, okay, fine, I'll see what it is. And by and by, I started doing the quizzes, and then the rapid revision is like the best thing. It is so nice and so properly guided that anyone can pass simply by following what Dr. Samir sir and Dr. Bone Marrow is saying. They will scold you, they will guide you, they will do everything, but it is for your own benefit. And if I can pass, anybody can pass. This is the thing which I want to say. So thanks again.
Yes, yes, Dr. Vartika. Thank you for the kind words. Can you please tell us how were the mocks and how did you score in the mocks?
In mocks, I was about sometimes I scored 80%, sometimes I scored 75%, and mocks are so good. By solving mocks now, you will be able to judge yourself and your own progress. And what I did in my previous attempt, I was not able to revise that much, and that was where I lagged. Here, even if you don't want to revise, you just follow the quiz, you just solve the mocks, you just see the lectures, just go through it, and it will come naturally to you. That is what I have felt. Because in my last 10 days, I was not able to study because of everything what is going around me. And it was the daily preparation which has guided me through the exam.
Okay, and how was your experience on the day of the exam?
The day of exam was like, it was during the first session, my this their video monitoring got off. So I got panicked after giving my first attempt, what is going to be for my next session. But when I called you and Dr. Mohan Mehta, you said, okay, stay calm and you will go through. So it was, overall, it was fine. And giving an exam in your home setup is a edge for everyone because it is a comfortable place. And overall, it was okay.
Okay. Yes, thank you, Dr. Vartika. And I'm glad that even after so many difficulties, you managed to pass the exam with all your hard work. And all the best for the
Thanks a lot, sir.
exam.
Thanks a lot.
And we will try to help you with that also,
Sure,
even
sir.
though we are not we are not much familiar with the ENT OSCE thing, but we'll still try to help you.
Okay. Thank you, sir. Thank you.
Thank you, Dr. Vartika. Next, we have Dr. Naveen. Dr. Naveen, are you here?
Yes, sir, I'm here.
Yes, Dr. Naveen, how are you?
Hi, sir. I'm really good and also happy, and I hope you are also doing good.
Yes.
I don't know how to express this moment. First of all, I would like to thank IAM team, Dr. Sami, Dr. Bonmaro, Dr. Bhargav. They have been doing very dedicated, and they're very honest, and they're actually like a big guru for me personally. So I'm so glad and excited to share my experience as well. So coming to my experience, it's actually my second attempt. I gave my first attempt in last September 2020. The difference what I found is the lack of understanding the concept and the revision. And then I was so disheartened seeing my result. Then I was like lost for few weeks, and then I was like, what to do? Who do? Like I was definitely needed someone to guide me, like proper mentoring and all this. Is I was so desiring for those things. Fortunately, I come across about I am in a Telegram group, and also one of my junior has told me. Well, then even then I was skeptical. Will the amount is I'm going to pay is like reserved for this? I was so skeptical about it initially, but once I see, I even attended last testimonial. Like what we are doing now, we attended that last time. Then I saw many people, many surgeons sharing their experience, lovely experience. Then I got really motivated. I completely trusted IM team. Then I joined. I messaged Dr. Bono that I want to join. Then, then the moment I joined, then weeks later I could already see the changes, and it's a really real game changer. So I would definitely suggest I am for every person who are listening now. I know that everyone having the same doubts, fear, insecurities, and all those things. But I would like to say that go just blindly trust IM team. They are going to help you. They're gonna push you. They will be there to every moment in this journey to make sure that you're gonna pass this exam. Yes, sir.
Thank you, Dr. Naveen. Thank you for the kind words, and I'm sure that you're gonna like perform really well in the OSCE also, and
Yes, sir.
we will be there for you for OSCE also.
So, yes, sir. Before I just want to add a few more like
Yes,
points.
please.
I want to tell that I want other candidates please to target like higher. What I did last time was I was just thinking to pass the exam. I just want to pass. I want like for example 70%, 72%. So this time I was my target was high, so that my preparation changed automatically. So my preparation went the way I prepared, the way I followed your material, the revision times also automatically increase. So I want all other candidates please target to higher scores, though, so that at least we will get above passing marks. That is what I want to say, sir.
Yes, that is a great piece of advice for all of them. Yes, Dr. Naveen.
Yeah, and also silly mistakes, sir. During exam, what I did is I did silly mistakes like not reading the question properly. Some of the question after I came and just checked it. And one thing is we have to go with the gut feeling. So it is, I actually changed 10 to 15 questions second time, which I made mistake. All the first options was correct when I came and saw. So please go with the gut feeling. The first answer that comes to mind is always correct. It is 100% always correct. I just want to tell that please don't change your options second time during the exam.
Again, is a very important thing that you told, because I always say, unlike Indian exams, because Indian exams, they try to trick you. But unlike Indian exams, MRCs, they just want to test you whether you are a safe surgeon to practice in UK or not. So they do not want to trick you. Even if
Yes, sir.
the question appears very simple and straightforward, go with your gut feeling. If you think something is the correct answer for a particular question, please, you must select that.
Yes, sir. Yes, sir. Yes, I just want to end by saying some quote for the IAM. So see, we might be preparing for the battle, but IAM will prepare you for the war. Definitely, this, mark my word, you will not regret. That's also. Thank you and good luck for all the candidates.
Thank you, Dr. Naveen. Thank you so much.
Okay, sir. Okay, sir.
Okay, next, Dr. Sujan Raj has asked a question that being an orthopedic surgeon for 4 years, I find it very difficult to study head and neck anatomy. I want to know the secret of success in this situation from an orthopedic surgeon. Although Dr. Bone Marrow and me, myself, we are orthopedic surgeon. I want to invite Dr. Harish to answer this question.
Good evening, Dr. Samir. Good evening to all of you. And thank you very much for mentoring us, guiding us all the way to MRCS. Um, as an orthopedic surgeon, I was also very skeptical. Reading and learning surgical things, general surgical anatomy, procedures was very it seems very difficult for an orthopedic surgeon. And I am a very old orthopedic surgeon, I must say. I am 15 years post PG. So I have never decided to go for MRCS in my life earlier. So this time it was my first attempt. I was like very, very skeptical that being an orthopedic surgeon, I will never be able to pass MRCS in my first attempt. And this was the main query which I raised to Dr. Bodmero and Dr. Samir, that whether this course is suitable for me or I should go for a more comprehensive kind of course. And I must thank all the IAM team that they have guided us with all the necessary topics, with all the necessary materials to pass this exam. The best part of IAM course and curriculum was that you are like fed with the answers itself. You are able to understand the question better so that the answer itself comes to your mind. As an example, I would like to tell you that you would say, if you prepare it by your own, you will feel that you will learn all the cranial nerves. But Dr. Samir told us that just learn 5 and 7 thoroughly. And these are the questions are almost always on these two nerves itself. And there are so many other small tricks which helped us a lot. And this was the main difference which IAM made to our preparation. And we did it very smoothly in a very concise manner. The course, the questions were so well targeted that I could pass the exam. And it was very nice experience. And I wish a very good luck to all of you candidates. Thank you again.
Thank you, Dr. Harish. Thank you very much. Next, we have Dr. Sanjay, and I'll open the mic for all the doubts. Now, if you have any doubts, please raise your hand in the app and we'll continue with Dr. Sanjay. Dr. Sanjay, are you here?
Yes, sir.
Yes. How are you?
Hello. Yeah, I'm fine, very fine. How are you, sir?
I'm also good, Dr. Sanjay. So we'll start with the queries. If any of you have any queries, please type in the chat box and we'll ask Dr. Sanjay. And
Okay,
yes,
sir.
Dr. Sanjay, please tell us about your preparation. How did you start it, and how was your experience on the day of exam? Everything.
Okay, sir. I'm Dr. Sanjay Sharma. I'm post MS surgery. I joined IAM
in the month of March of our very last. Actually, I was in contact with IAM since beginning, since I think December, but I was not sure of joining you. I had joined some other course also, but was not suitable for me, the timings and all. So I always wanted to be connected with you people because I had attended your these sessions we have been which is being done today. So I was very sure about joining you. That talk with Dr. Boom Meru and I joined your course. In fact, I should tell you by before joining this course, I was not sure of even passing or going even near to passing marks. But you all guys, Dr. Bhargava, Dr. Bomeru, Dr. Sami, you yourself are very helpful. And this was my first attempt, and I could score 88.929% marks. And I was thinking that I will just get my passing marks. I might not get too high marks. So all because of you people. Everything which you provided was very good, and it was to the point and very informative. And the last 10 days master classes and the recall sessions, all of you were very helpful. And by this I could achieve my target. And what Dr. Naveen had said earlier, that don't just aim for passing marks, try to score as much high as you can, so that, and I'm sure that what you'll be thinking, what you'll be aiming, will be getting definitely. And about IAM, one more thing I want to add, that whatever you invest in IAM, it will be worth it, and you definitely will be benefited out of it. I think so. That is what I want to say.
Yes, Dr. Sanjay. Somebody has asked that how many months minimum do we need to prepare?
For me, it was 2.5 months, but usually people say 4 months will be more than sufficient. And giving daily around 5 to 6 hours, if you can give, is slightly longer, maybe 6 months if you're giving less than 4 hours or 3 hours if you are managing. I think.
Okay. Okay. Whether to subscribe to EMRCS or pass test or not, and how is the difference between the IM material and EMRCS and pass test? Whether the subscription is required or not, they are asking.
I must say that I bought the subscription of EMRCS because uh, I thought in initial months I won't be taking any course or any coaching guidance. But IAM people will be providing you all, even the past tests, their mocks, their recalls material, and their EMRCS questions. Dr. Bhargava has been conducting daily quiz sessions, which are, I think, we had been solving around 150 to 200 questions almost daily, as far as I remember. They're more than sufficient, and they will give you those practice sessions time and again. So I don't think if you are connected with IAM, you no need to go for EMRCS subscription. I think so. But I had bought one because I was not initially connected with IAM.
Okay. Okay. Thank you, Dr. Sanjay. And we have one question from somebody. Yes, Dr. Shamli, that how should a fresh MBBS graduate plan their preparation for the exam, especially for the second paper, and what resources should be used? So, Dr. Naveen, please, I would request you to answer this one.
Yes, sir. First of all, I would like to say I'm also post MBBS graduate. So usually the material from the MRCS and past test is sufficient, but in what in IM they do is they have combined both. That involves both. In fact, more than that, they have also collected lots of sources from different material. So that will suffice for the part B paper. Definitely, there is no doubt. And the daily quiz, and the mock, and the grand test, and everything involves indirectly about for part second paper. So I think we should just follow IAM. Again, I want to say just IAM notes and materials and schedule is sufficient to understand the part B.
Thank you, Dr. Naveen. Yes, Dr. Sanjay. Uh,
Yes.
Dr. Mahi has asked that he is a first year postgraduate in orthopedics and fresh from NEET PG, and how should he prepare and what resources should he use?
I advise him to join IAM immediately for the September session itself, and people will be able to guide him very well. And I think all the materials which you will provide will be sufficient for him to pass the September session. I think so.
Okay, okay, thank you. And Dr. Soumya, she has asked, I have completed MBBS last year and is currently preparing for NEET PG. Can I prepare for MRCS along with NEET PG? Yes, Dr. Soumya, you can. And should I go for MRCS held in September, or should I wait to get a postgraduate stream and then go for it? Okay, Dr. Soumya, for you, my advice is, if you are interested in surgical specialties, even in NEET PG, then you can always go for MRCS because it is for surgeons. And I would suggest that the preparation for NEET PG and MRCS are almost the same, because for both the knowledge required is at the level of an MBBS graduate or an undergraduate level, the knowledge they want to test, and the questions are almost similar. It's just that the key points and the topics are similar, but the questions are more clinically oriented, like the pattern they have recently changed in NEET, also clinical based. So yes, all in all, you can go for MRCS also in September, as your NEET PG has been postponed, and it will take only 2 to 3 months of preparation if you are preparing for NEET PG as well. Yes, Dr. Amer has asked what all books to follow. Dr. Sanjay.
I already told sir that just follow what IAM has been advising and guiding you. No need to, subscribe to or purchase or to buy some other online sources. Just follow and just blindly follow you people. Will be more than sufficient, I think.
Okay, thank you. Thank you, Dr. Sanjay. And Dr. Aziz has asked when the exam reverts to offline. Online mode has many issues. Dr. Aziz, with the ongoing pandemic everywhere, we are not very sure when they are going to reverse it to the offline pattern. But I feel, although the online pattern has many issues, but in the current scenario, it is the best that you can have, because you save on traveling, you save on stay, your hotel and traveling expenses. Again, you are protected from getting COVID or infection, any infection, while you travel or go to other places. You are giving the exam from the comfort of your home. So I think online pattern is much better than the offline, for at least party. Okay,
One more
so
point I want to add, sir.
yes, yes, Dr. Sanjay.
This always better to give it online exam because the atmosphere which you get while staying at home and giving exams makes you completely relaxed. One thing. And regarding my exam experience this April 2021, I could tell you very clearly that I could, you know, complete my both first and second paper within an hour. I just after it was given 1.5 hours for 90 questions each part, I could, complete it within an hour. Another half an hour, you know, I submitted earlier also. I was just revising it easily. It was just a cakewalk for me with your guidance and your, repeated practice sessions and quiz sessions. It was so easy for me. I didn't believe it. This happening like this with me. So always I think online examination pattern will be a better option than offline.
Okay, thank you, Dr. Sanjay, for your inputs and kind words. And hopefully, we'll work together for OSCE as well.
Sure, sir, sure.
Yes, thank you, Dr. Sanjay. And thank you, everyone, Dr. Dinesh, Dr. Sumbal, Dr. Vatsal, Dr. Jain, Dr. Vartika, Dr. Naveen, everyone, Dr. Sanjay, for joining us. And I think we don't have any more queries now. So we'll finish this session for now. and we'll see you tomorrow in the quiz.